Others were also questioning the state's count.
We had a coroner in Montezuma County. He had a death, an alcohol death, and it was counted as COVID.
It wasn't just happening in Grand County. Dr. James Caruso is chief medical examiner and coroner for Denver.
We remove the organs, we weigh them. I was told by some of my fellow coroners in the more rural counties in Colorado that it was happening to them, that they knew of issues where they had signed out a death certificate with perhaps trauma involved, and they were being advised that it was being counted as a COVID-related death.
When it comes to counting coronavirus deaths, tell me what the story was of what you discovered early on, what was happening.
Well, I think early on, the people signing the death certificates probably were doing it accurately, but at some level, maybe the state level, maybe the federal level, there's a possibility that they were cross-referencing COVID tests and that people who tested positive for COVID were listed as a COVID-related death regardless of their true cause of death. And I believe that's very erroneous and not the way the statistics needed to be accumulated.
Caruso says he voiced his objections in April 2020 with the Colorado Department of Public Health. How did you raise your concerns?
I told them very clearly that someone can die of COVID or they can die with COVID, and the two are very different.
I had a homicide, suicide, the end of November, and the very next day it showed up on the state website as COVID deaths.
Within a week of the murder-suicide, 2 more Grand County deaths popped up on the state's COVID count. Bach investigated and found out why she had no record of them.
But 2 of them were actually still alive, and yet they were counting them. Had I not called them on it and asked them who those were, where were they from, all the information about it, and it's like, oh, well, that was a typo. They just got put in there by accident.
And where Bach says there were no COVID deaths in 2020.
Not as far as I'm concerned.
When we checked in July, the New York Times tally over-reported Grand County's 2020 COVID death toll by at least 500%. It was missing 1 resident who reportedly died of COVID outside of the county, but the Times counted an unrelated heart attack, the 2 people who were still alive, which were removed from the state total, and the murder-suicide of Lucas and Kristen Riley. What are the implications nationwide when we're looking at numbers, Ben?
I believe they're very inflated, and I don't believe that what's going on is the truth.
During our visit to Colorado, the state's total COVID-related death tally was 13,845. Separating out the deaths not directly caused by COVID cuts that number by about half, with the rest dying among or with COVID, not because of it. The obvious implications are huge. If such a significant number of Colorado's COVID deaths weren't directly caused by COVID, or even related at all in some cases, and if that bears out in other states, it means the national totals we've heard since the start of the pandemic could be largely misleading.
So I think in this country, we've taken a very liberal approach to mortality. And I think
at the same time Colorado's coroners were challenging the death count, Dr. Deborah Birx of the White House Coronavirus Task Force was being asked about the same thing.
The intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
Some of the eyebrow-raising examples of deaths attributed to COVID include fatalities after traffic accidents, 3 Colorado nursing home deaths, even though the attending physician said they weren't related to coronavirus. And a case in Nashville, Tennessee. In August 2020, Hal Short's wife was stunned to see COVID-19 named as the cause on her husband's death certificate after he died of an aggressive cancer. He tested negative for coronavirus 3 times. Only after the family complained was COVID-19 removed, a clerical error blamed.